All right, so are we going? Okay, this is our endorsement interview with Representative Maxine Dexter, represents the 33rd District.
Yes.
Here in our wonderful state. Well, if you could just tell us, and obviously your opponent is not here today, so I would issue all sorts of warnings about talking over one another and saying this isn't a debate, but it can look like one, but that's moot. If you could just tell us a little bit about your district.
Sure.
And your tenure and what you hope to achieve in another term.
Great. So my district, the 33rd, has actually changed more than any other district with redistricting in the state. So I've got 30,000 new people who will be hopefully seeing me on their ballot in November. It's Northwest Portland, currently in Northeast Washington County. So those are the groups that I've had the privilege to represent so far. It will shift to being just south of Portland State and extend along the Multnomah County line and between the Willamette River to the county line to north of Linton. So, I spent a lot of time representing and getting to know the issues for unincorporated Washington County, which has been, a real challenge for those communities, and unfortunately I won't have the opportunity to still represent them, but I can bring that knowledge to the housing work that I'm going to be doing in the next session. And now I get to really focus on Multnomah County, which I think is something that a lot of people really would appreciate because there are so many challenges here. In my tenure, I've been very proud to sponsor some healthcare reform bills, some air quality bills. One of my most proud achievements so far is the ombudsperson was finally appointed for the state prison system. That position hasn't been filled for at least 20 years, and this came front of mind during the wildfire season and COVID outbreaks, that the adults in custody and their families had no one to really reach out to find out what they could do to advocate for themselves and their family members. And
in the wildfire?
During the 2020 wildfire season, there was a lot of mass evacuations and movement of adults in custody, and there was an outbreak of COVID potentially related to that. And so during that time, that was right after I was appointed, or just a few months after. And there was no one to reach out to, and we realized that there hadn't been anyone in this position for over 20 years. And so it's been since then that I've been working to get this position filled, and Governor Brown just appointed somebody last week. So
last week?
Yeah.
Wow. Are you pleased with the choice?
I am very pleased with the two people we put forward to her. I am not actually sure which person she appointed, so she let me know that she had chosen somebody, but I don't know who that is yet. So.
Okay. All right.
Yeah.
And what do you see coming? What do you want to do? I saw on your website you were talking about universal health care.
Yeah. So
that's a big bite.
It is, and so I will just say that I'm a pragmatic iterativist. I don't believe in massive shifting. I think proving policy effectiveness with pilot projects and continuing to evolve the policy is a much more grounded way to do things. We are not good at understanding every implication of a policy and implementing it perfectly, so I believe that no policy is perfect, that we need to continue to work on it. I don't think universal health care is going to happen without ongoing steps towards it. It's not, suddenly everything's not going to be a single payer plan in 2 years. But
it sounds that way. I think the term sounds that way to people, that you're going to suddenly flip a switch.
Yeah, I was really careful with the wording, and if I'm not being clear, I need to go back, that universal health care access is different than a single payer plan. And I think that everyone needs to have reliable access to affordable health care, period, and we need to do whatever we can to get there. A single payer plan may or may not be the right way. I honestly think that there's some steps in between that'll help us flesh that out. So, but my priorities for 2022 are going to be housing as chair of the, or interim chair of the housing committee, healthcare reform, including opioid harm reduction policies. I've got a package that I'm bringing forward. and then climate. We've got work to do.
What's in the opioid package?
We have 10, 11 bills right now that include everything from allowing school staff to administer Narcan to a student on campus. You wouldn't actually believe, I think, that right now that's not legal. To getting Narcan out with our first responders, they can administer it, but they can't distribute it. So allowing people to distribute Narcan, allowing emergency room physicians to distribute Narcan to patients as well as people with them to take home with them. Having it in public buildings is another one that we have.
What's the drug name of Narcan?
Naloxone is the generic name.
Yeah.
And so we actually, that's another one of the bills, is changing it to short-acting opioid reversal agents, because Narcan is one. We don't want to have to go back and change the statute when there's more, because right now naloxone is actually becoming less and less effective as fentanyl is becoming more vigorously
engineered. Yeah. I read somewhere, I think it was in the New York Times or somewhere that talked about if somebody was proposing one simple change, which is if you made, if you made, God, I'm blanking, it's 9 o'clock in the morning. What's the drug you take to
reverse it?
No, as a substitute.
Methadone?
Yes, methadone, and what's the other one?
Buprenorphine.
That's it, buprenorphine. Yeah. If you made those much more available and let people get a prescription for those things instead of having to show up every day to get them, that this person was saying you could really take the burden off of people who struggle with these dependencies. What do you think of that?
So I think every policy that has a lot of merit needs to be thought with the downstream impacts of that. So I don't disagree with the fundamental philosophy of that. However, buprenorphine and methadone in particular have very long-acting effects that as a critical care physician, I've had to put people on naloxone continuous infusions to keep them alive with a methadone overdose, because it's so profound.
With a methadone overdose?
Yeah.
Okay.
Well, and with any opioids it can happen, but methadone in particular has a very long half-life. And so what we're seeing in our communities right now, fentanyl is a short-acting opioid. Naloxone can revive someone and it may not last long enough, they'll need it again. With methadone, you might need it for hours or days. And so if that, overdose potential in our community is sufficient that somebody's not having to come back to get their dose, there's a really high overdose potential there. So I think in the right settings, that might be appropriate, where there's, pretty close supportive housing or, different situations where that could be the case. But in general, just handing someone a big pack of methadone is honestly like another disaster waiting to happen. And so I think that somewhere in between there is probably the right policy.
Got it. Yeah, this person was, very maybe I misread it. Maybe there were safeguards that needed to be in place.
I'm sure, I will not take away from the fact that we have an enormous problem, and what people need is access to treatment and sustained prevention of withdrawal, because that's one of the most uncomfortable, traumatic things that you can see somebody go through. So, without
did you see the Vancouver piece about what they're trying in Vancouver?
Yeah, I actually have one of my dear friends is working up there with the Women's Hospital and has been working in this area for years. And so we've been talking about this a long time, and that is a policy that, their harm reduction package is doing a lot. There also is, as you probably have read, people who feel like it's enabling a lot of drug use. And I think what I would say is it brings people to the facilities where there's treatment or where they can safely inject. I don't believe it's increasing the use. I think what it's doing is bringing people out of the shadows, and ultimately that's going to be how we get them treatment and save lives. So it's really challenging for the people in those neighborhoods, and I completely embrace that and understand that. And
the people in the neighborhoods where these people are coming for.
Yeah.
Is the Vancouver idea that you tolerate a certain amount of, people need this to get through.
Yeah.
Let's help them get through.
Yeah.
Yeah.
Would you support a similar thing in Oregon?
I think that The harm reduction package that I have set forth is going to get us partway there, and then we need to reevaluate and see. I do think that there's a lot of merit there. I think that trying to find alignment with, I don't want to shut down the benefits of the harm reduction package I have by bringing in something that so many people will have really strong negative reactions to. So what I'd like to see is myself and the Clinicians Caucus and many other stakeholders who are already in support of it, move that forward, and then we have real conversations about safe injection sites. Like, we need to have conversations about that, but that is not part of what I'm really pushing to get past this session.
What are your thoughts on Measure 110?
Thank you. How did I know you would ask me that? So I think it was a policy with good intentions, and just remember, this was brought to us by the voters. So, this was not crafted with, legislative stakeholder engagement. And so I think what my vote yes in support of Measure 110 was wanting to, one, acknowledge that we have a major issue and we need funding to address it, and two, that voters put a lot of time and effort into this policy, and I didn't want to undermine the will of our voters. Has the implementation been optimal? No, not at all, and I think we need to really double down on that.
Is there anything the legislature can do about the implementation at this point? And is anyone working on any bill that would, I don't know, do something?
Yeah, where would you put your harm reduction?
Yeah.
Does it have Measure 110 and it's...
I think that it is a very nice complementary set of policies, and certainly the people who are involved in working on Measure 110 implementation are supportive of this, at least the ones I've talked to. I certainly can't globally speak to that, but are supportive of this. So I think that these are complementary and important. The Behavioral Health Committee and many other groups are really trying to get the workforce and access issues addressed that really are fundamental to getting people treatment. Measure 110 only works if we have the resources that we need to treat.
Yeah. Where in your mind is Measure 110? Where's it failing? Where are the bottlenecks? I feel like I read so much about this and I still am not clear.
I think there's two things, at least from where I sit. Remember that I'm not intimately engaged with all this, so I can't speak to technical details of this, but what I would say is people who pass policies and know that they have been implemented or that they've started want to see results immediately, and good change takes time. And I think what we have, in the city of Portland, Multnomah County, we have a recurrent issue with not giving good policy enough time to see results. Changes of leadership, frustrations. I led a healthcare organization. Like, people don't just suddenly change how they do things on a dime.
Wait, Kaiser or what organization? Sorry.
So Northwest Permanente is the physicians group.
Okay, right.
So we are married but separate from Kaiser. And I was chair of the board of directors there. And
Are you guys contractors to Kaiser?
So yeah, it's a closed marriage. So we only take care of. That's a good. It's like, if you think about it,
it's monogamous.
It is. We only take care of Kaiser patients. They only contract with Permanente physicians. So we are aligned, but the beauty of that system is that the insurers don't pay my salary, that I have autonomy as a provider to do the right thing for patients without the person who's paying my salary telling me that, if I don't do things, that they're going to change how I get paid. So
what you were saying, as a leader of a healthcare organization,
when you implement policy, it takes a lot of time to educate people on what's changed, how you can support them in that change, and making sure it gets implemented. It really is hard to get good change, and if you change the outcome you're driving for too quickly, you drive frustration and disorganization. And so, I don't think repealing Measure 110 is the right answer right now. We've already put a lot of time and effort into building these systems, and there's a lot of money there. Like, we need to do the right thing for people. Clearly, Oregon has a crisis right now with substance use and mental health issues. We need to be able to really do whatever we can. So, is it perfect? No, but remember, I'm an iterative pragmatist. I think we just need to keep moving the needle and making sure what I think ultimately we need to do is decide what our outcomes are that we're looking for, how we're going to measure success, and then transparently show how we're getting there so that people can see whether or not we're moving towards it. And if we're not, we need to make changes.
Yeah. Unfortunately, that's not as sexy as let's toss it out and do it over, which I think like 2 out of 3 governors candidates have said now.
Yeah, and I just would disagree with that.
Yeah, no, what about on homelessness, since you're going to be more engaged with the new district? How do you feel about how the Metro money is rolling out and how it's doing?
Yeah, I mean, I had the opportunity to be at the Housing Oregon conference with Lynn Peterson last week, and she very clearly is showing a lot of success with those dollars. We've gotten only 55% of the funds spent and over 80% of the projected success achieved. So we're going to have extra, we're going to, really outdo what they had said as the measures of success, which I think is really a powerful statement. I walked through Beaverton with Mayor Beatty last week and saw one of the first Metro bond supported affordable housing complexes. It's amazing. We need to keep building on that. Affordable supportive housing is something that we need. We need to build housing.
Are you talking about the SHS measure? The supportive housing services?
Yeah.
Oh, okay.
Yeah. Metro.
Yeah.
SHS, yeah.
So, and what Mayor Beatty said very clearly is without those dollars, they wouldn't have been able to have the support services that they needed. And then with the bond for building housing, we also are seeing that those dollars are being implemented. So those are, a married policy that are really important.
We talk a lot in here about housing first versus shelter, and I'm not exactly sure I understand that there's this big a difference as everybody says there is. What do you see as the root cause, if you had to list the causes of homelessness in order?
In order.
I mean, I have my own list, just from reading, studies and things like that.
Sure.
But, I mean, what's the thing we gotta what are the 3?
My first priority is housing supply.
Okay. So you'd be a housing first type of person?
I think it's a yes and. I don't believe in black and white decision making. That's not how the real world works. We can do 2 things or more at once. So we clearly need to have shelters that work for people. There's no question there's a transition period for some. There's people getting evicted every day who don't have a place to go. We need family-friendly shelters. We need women's shelter. All the things. I don't know of a single patient of mine who feels safe in a shelter. And, I would just say that, when you're asked to leave every morning and you don't have a way to keep your things safe, my patients who have very expensive medications get those stolen constantly. They don't feel comfortable sleeping in a congregate setting where they don't have any sort of feeling of protection. We have driven people to a burden of instability with our lack of investment for 30, 40 years in housing. So we got here over decades. We're not going to get out of it in 2 years. Mm-hmm. So we have to build a steady and sustained supply of housing, and we need to do it at a much faster rate than we've been doing. And at the same time, build supportive services and ways for people to get a leg up. Our middle class is suffering more than it ever has in this country, quite frankly. I mean, some would argue. We need to rebuild the opportunities for families to have stability.
Did you see the piece, I keep mentioning news stories, but did you see the piece about Houston in the Times about 6-7 months ago?
I did, yeah.
And that was very much a let's build housing.
Yeah.
And I think it's much easier to build housing in Texas.
Sure, there's a lot fewer regulations.
I mean, is there anything the legislature can do?
Yeah.
To grease the wheels here? I mean, should we grease the wheels? Should we build stuff that's, smaller, less, up to code, up to environmental code? I mean.
Yes. Yes, I think the enemy of good is better. In this neighborhood, we have multiplex housing and no parking on the streets. You can walk down these lovely Alphabet District streets, and we have multiplexes that are now illegal through most of Portland. We love walking. I do. My family really enjoys this neighborhood, and it's one of the charms of Northwest Portland is these, very interesting sort of small multiplex, not congregate living situations. Those were built at a point in time when the Lewis and Clark Exposition was here and they needed tons of housing. We built in response to a demand. We need to build in response to a demand now. And
So you think those would be illegal now?
Yeah.
Given
Because of codes.
Yeah.
Now with the infill, with HB 2001, like we are able in some areas to be able to do that, but there's still local regulations around parking and other things that are still going to be a challenge in some areas. So what I would say is we need to think innovatively. If you talk to developers, they can't pencil out affordable housing in small units and make them profitable. We have to figure out how to address that. The system development charges that we have being waived is an important one. Thinking about how we convert commercial properties to housing in the city of Portland is a really important consideration that we will be bringing policy forward on. How do we use single room occupancy units with shared kitchen and laundry and bathroom in some areas may really help facilitate sharing of resources in multi-generational sort of units where you might have people you might have middle-aged people who have small children who can't work outside of their home but can help elderly people who want to live and age in place. I think that we need to really push the envelope of what we're considering is acceptable. I had a patient last week who has his mother and father and his 96-year-old grandmother living in a duplex that has two different driveways to it, so they both are single level units, and his sister was coming to live with them so that they could take care of these three elders in this one situation. And he was like, thank God there was someone out there who built something that worked for our family. We need to really consider like multi-generational.
No, and we're not building starter homes anymore, or so I read.
No, I actually tweeted about that last week. Because our house, when we were first graduating from med school, like that was the dream, right? To build get a small house. We had a 829 square foot house in Denver, Colorado that we bought for $198,000 or something like that, 95 actually. That would not be achievable on a resident salary right now. It's over $500,000 for that same house right now, and the median income hasn't accelerated with it. Like we have created an impossibility for people to achieve generational wealth, and that just has to fundamentally change.
Where are you at on policy to spur commercial to residential building?
Where am I?
Yeah.
I'm totally supportive of it. I think we need to bring people back to the city's core where we have resources and transit, and we need to address food deserts that are there in some of those commercial regions, but we absolutely need to do whatever we can to help that happen.
And where are you at on like sort of crafting a policy to make that happen? And what would that look like?
Yeah, so I don't have, the policy ready. Certainly working with multiple advocates. We have meetings scheduled to talk about this. I talked with some of the mayor's staff about this just a week or two ago, and I've talked with several of the developers about this. There's lots of innovative housing conversations happening. Rep. Marsh is leading some, Senator Anderson's leading some, I'm leading some. I think we all agree that this is an all hands on deck moment, so good ideas are going to get circulated as we move closer towards the session, but I think really digging into this and how do we make it pencil out for developers, as well as building the community supports to make it a livable, high value proposition for families that want to be in those spaces.
What ideas have been thrown out about what that policy would actually do?
So City of Portland waiving the SDCs, liberating codes that would potentially not allow for single room occupancy or congregate settings. If you think about how those buildings, and I'm sure you've thought about this, how those buildings are set, the facilities, the plumbing, all of that's in the center with lots of windows and cubicles or large rooms around the outer edges. So how do you convert those into livable property without costing an enormous amount of money to put in all of the facilities. If you require that each unit has a bathroom, kitchen, whatnot, that's not going to work very well. So we're going to have to liberate those codes.
What about like tax alleviation? Is that part of the discussion?
Yeah, I think that we need to incentivize corporations to use those properties and figure out how the state can facilitate that. Whether it's, and I am not saying that I'm proposing a policy here, because I think that really we need to think about what are the implications for tax abatements and different options versus long-term leases. However we transition, it needs to not be rigid in trying to fit new policies into old statute.
Mm-hmm.
We're going to have to make some changes.
Mm-hmm. Well, how do you feel about city employees not coming back to work or coming back to work? Do you think they should be mandated to show up to the office?
I don't think we should mandate that. I think people have, I was a working mom who would have really appreciated being able to see patients from my kitchen when I was taking care of toddlers who didn't have access to preschool. Like that, I think, is in everyone's best interest. We have lost an enormous proportion of women from the workforce, and how do we figure out how to make that feasible? I think people like to be in offices sometimes and not others, and we need to figure out how to make it flexible. I don't think mandates. I think people have lots of feelings about mandates right now, and I wouldn't propose that we move towards
Another case for iteration.
Yeah.
On going back to work.
And if people aren't coming back to the city of Portland to work, but we are bringing them back because they live in those areas, if you can live and work and have your children going to school and go shopping in a walkable neighborhood, that's a heck of a lot more resilient and certainly has a lot of desirability for a lot of families.
What if that neighborhood's in Texas? Because don't we have some people who are like working for the city and living in Texas?
I don't know about that. Somewhere.
Somebody
Hawaii,
keeps
there were a
saying
few of those.
Hawaii.
But anyway, that's
Hawaii.
I keep hearing about this. Yeah.
Where do you encounter patients who are in? You mentioned that are fearful of shelters. Are they Kaiser patients who?
I take care of Kaiser patients.
And they're living.
Well, remember, Kaiser has a very large proportion of our patients that are Medicaid based as well.
Yeah.
So with the CCOs, all of them have a significant proportion of Medicaid members.
So you're seeing this. I mean, you're seeing this.
I mean, I work in the critical care unit. I've had a significant increase in the number of patients who have suffered overdoses, and that's one reason that I'm driving this policy is we've got to address that. And the houselessness and being on the verge of losing your housing as a result of the cost of your medical care. Every week I have to have a conversation with somebody about whether or not they're going to pursue chemotherapy or getting a PET scan, or because they are making real choices about paying rent or getting the health care that they need. And I will not tell you that it's unusual for patients to defer on care to preserve the stability of housing for their families. And that, I mean, it's almost going to make me cry. That is an unacceptable outcome.
And these are people who are you talking about people who are insured through Kaiser like I am?
Yeah.
Who still have to make these choices?
Yeah, and that's what I mean. When we say universal coverage, it doesn't mean that you have a health insurance card. It means that your health insurance card gives you true access to affordable coverage. And that is not true with a lot of these high deductible policies and others that, you're making choices because your deductible is $5,000. That's not a reasonable out-of-pocket expense for the vast majority of Oregonians.
Right.
What can the legislature do about that?
Well, we have the Medicaid waiver that was just announced last week that we're really excited about expanding coverage continuously for children up to 6, that we are going to continue enrollment for 2 years. One of the major issues with our Oregon Health Plan members is that you can lose your job and find a job and go in and out of Medicaid so quickly that you have disconnected coverage. And you've heard me talking about this. You need sustained investment in policies. You need sustained investment in people's health to be able to make a difference. So sustaining that coverage for 2 years is going to make an enormous difference. houselessness and adults in custody transitioning to the community, that's going to be covered, and there's even going to be coverage for 6 months of rent for a lot of those individuals.
How is that going to be covered? What, the transition to be covered how?
Yeah, so Medicaid is going to fund up to 6 months of rent for people who are experiencing houselessness, moving out of justice-involved areas where they've been in custody. Can you imagine that pencils out, that 6 months of rent is a good investment for the federal government?
Better
versus,
than...
I mean, this is medical coverage.
Okay, is this this is just the Oregon waiver? This is our waiver?
Yeah, this is our waiver. So, and Massachusetts was given similar waiver from, I understand that they were also given a housing allocation with their waiver. So making it affordable for those on the fringe is important. I would move us up to the 400% of federal poverty level.
For Medicaid and eligibility?
We need to get there. It's not going to happen with this Medicaid waiver, but I think for true sustainable coverage, we need to have Oregon Health Plan-like coverage for people up to the 400%.
Because right now it's up to what?
This one, I believe, is 180%.
Okay, but you'd like to see,
And
I mean,
don't quote me on
No,
that,
no,
because I honestly...
right, but I get your point. Yeah.
But we need to expand it. Like that, the people who have 2 children and are making the median income can't afford healthcare. These are not people who are impoverished. These are people who are working their long hour jobs, trying to just put food on the table and keep housing for their families, and they still have to make hard choices about healthcare.
How close do you think Kaiser is to getting it right? I'm a Kaiser member.
I'm a Kaiser believer.
Yeah, I mean...
Yeah. To the HB 2010 public option bill that was passed in 21, we amended my global budget pilot project, and we are working on that pilot, which is basically using a capitated prepaid model similar to Kaiser in a region across the marketplace to try to get to everyone being on the same page, that we're trying to drive for population health rather than paying you for the widgets that you do. Paying you for success, keeping people healthy, putting the insurers at risk. So insurers say, yep, we can manage your health for this amount of money, and if we do it well, we keep the profits, and if we do it poorly, we pay for it. Right now, the state of Oregon just keeps handing out dollars for all of the overage.
There's
no incentive to make a margin.
So if we get you in and get you a COVID back booster so you don't get COVID, and then you have asthma or you have a pre-existing lung condition and you end up in the ER and it costs us...
Let me pivot to a flu vaccine just because the COVID vaccine is so loaded, but I think...
Not for me.
But I think, absolutely. Preventative care, like investing in tobacco cessation, substance use disorder, mental health investments. Like, we wouldn't be where we are right now if keeping people healthy was incentivized. Sick care is incentivized.
So is this Kitzhaber's like buy the air conditioner for the woman who needs...
Air conditioners,
who needs...
They keep coming up, don't they?
Yeah, I mean, his whole thing was like, listen, instead of like bringing you in for heat stroke because, you're overweight, you have asthma, and then it gets hot as it does more often. He's like, buy the air,
Governor Kitzhaber, Bruce Goldberg, Mike Bonetto, a lot of the people who were all part of the Oregon Health Plan have done a lot of work talking with me and helping me kind of think through this. And all along it's been clear that a global budget was the next step of the Oregon Health Plan. So we are
global budget.
Global budget meaning that it's the capitated we just allocate a budget and you have to manage to your budget and keep people healthy. And all of a sudden you're incentivizing upstream investments like air conditioners, like housing.
Is that what the CCOs are supposed to do?
So they are doing it to a large degree, but they still are counting services and get reimbursement to some degree based on that. So absolutely, the CCOs are already doing a lot of this, but the rest of the market is not, and we need to bring them along.
So you're not in an area where there's a CCO, you're not in this?
So CCOs across the state are already doing this. But if you have, an ERISA a plan, or you have an ACA plan that you bought off the marketplace, or you've got
Okay.
an employer-sponsored plan, you're a PEB or OED member. That's not what we're doing right now.
And is every acre of the state covered by one CCO or another?
There are CCOs in every part of the state.
Got it.
I think.
Yeah, no, I know, this is getting into the weeds, sorry. My wife works in healthcare, so I just sort of hear this stuff and it's
Yeah, I'm
fascinating.
pretty sure that.
Yeah. You know, you said that people are fearful of, your patients would be fearful of going into shelters. And I think if I were homeless, I would be fearful of going into a shelter. I also think that if I were homeless in about 3 days of no sleep and deprived of, whatever medications I take and food, I think I would start to, have mental issues, almost certainly. Do you think there's a chicken and egg here? I mean, how many people, people say, well, homelessness is caused by mental illness and drug abuse, but I mean, where's the chicken and where's the egg here? I mean, Housing First sort of postulates that if you get people into housing, you might avoid these other issues. Does that sound correct to you?
Thank you for acknowledging that. Yes, I do. I think when people are under toxic stress, we know that you can only sustain so much before you become mentally unstable and unwell. Like we talk about mental health. You can't think about your own mental health if you don't have access to, Maslow's hierarchy of needs are pretty clear. Shelter, food, like basic needs have to be met before you can think about health or education or any of the other things that we also know predict outcomes. So yeah, I think if you are constantly unable to feel safe going to sleep, you are not going to get the same sort of restful sleep that you need. I will tell you, when I was working 5 night shifts in a row as a critical care doc, 5th night with very little sleep because I had young kids at home, I couldn't go home and sleep, and I felt safe there. I just couldn't functionally sleep. That 5th night, I was nearing psychotic, and I actually had to back off the number of nights I was doing because it wasn't sustainable.
Yeah.
Absolutely, we are driving stress.
I mean, so we had, we've had candidates in here who say we should absolutely make sure there's enough shelter beds for everybody, and once we do that, we can arrest everybody who's on the street.
I think that people in Oregon, people in Portland, are really frustrated with where we're at right now. I would really caution us from moving towards civil commitment without a plan, moving towards those sorts of interventions. We are not. It's okay to be compassionate, and I feel like being compassionate is starting to be seen as a weakness. And I know for a fact that compassion and building trust is the way that you move people towards accepting the care that you have to offer. I have those conversations every day with people who have no reason to trust me, and until they understand that I can connect with them where they're at and offer insights into why the things that I can offer them will help them, they have zero interest in participating. If your threat is go get substance use disorder treatment or go to jail, do you think people are really going to embark in that? And what are we going to do when we start committing people? Like, are they going to stay in jail until they're well? Like, that's just not going to happen. Like, that's it's a good talking point. If you play that out, it doesn't land in us being in a better place.
Anything else?
I thought that was pretty thorough.
Okay.
Yeah.
Anything we didn't hit? We got the big ones?
I know better than to
Healthcare.
offer more words.
We can go to our fun question.
Yeah, also, but we need the unfun question first,
Oh no.
which we forgot at the beginning.
Oh, age.
And I'll go first. I'm 57.
Okay.
I'm
Okay.
26.
That's easy. This is an easy one for you.
I know, this
Okay.
is, I
All
really
right,
excel
fine.
at this one.
Yeah.
Do you want to know how old I am?
Yes, we have
we need
to.
know how old you're.
Public
No,
information.
no, but we need to know.
But it's so much easier to hear from the
There's a
source.
wrinkle. We need to know on October 17th when this issue publishes. How old will you be?
I will be 49 years old.
See?
I feel like that's like the 4th candidate we've had that's going to be 49.
I turned 50 in December. I'm very excited about it. But, yeah.
Oh, I have one question. Do you know who you're endorsing in the city council race?
Which city council race?
Hardesty and Gonzalez?
I am endorsing Joanne Hardesty.
Okay.
Yep.
And then you're endorsing Sharon Myron, right?
I am.
Okay, cool.
Interesting.
I know that.
Interesting. Doctor connection?
Sharon has been a supporter of me since I first decided to run for office. And so I've also I believe that Jessica Vega Peterson and Sharon both have very good skills that they would bring. Some of these endorsements are relationship based, and Sharon and I have worked for Kaiser together. I know her heart. I know that she is a smart woman who cares about the right things for the community, and she was there for me when I was in a really tough primary. I felt that it was, important for me to stand with her. That being said, I have zero concerns about Jessica Vega Peterson, her leadership capability. I will work with whichever chair is there wholeheartedly and with determination to do the right thing for our city.
Cool. Thank you.
I
so much for coming.
imagine you've made a governor endorsement, right?
Oh.
Oh, the funny question. Not
Oh, yeah,
funny.
come on.
All right, so if the world were ending tomorrow, what's the last food you'd eat? Not meal, food.
No,
Food.
Well, people have said meals.
I know, but it's supposed to be.
A fresh peach off the tree.
Oh, that's so healthy.
That's a good one.
You and your Peloton and your peach.
No,
Hey!
actually, my husband and I, one of our very first dates, he came to Wenatchee, Washington when I was doing a rotation there, and we went on a mountain bike road and found a peach tree.
Oh,
and
that's
it
cool.
was like warm peach in the sun, and like from then on, it's been like one of our
That's neat.
one of our things.
Where did you live in Denver? And what were you doing? Were you at the hospital there?
Yeah, so I graduated from med school in Seattle and then went to Denver for our residency and my fellowship. So we were there for 8 years.
Where'd you live?
Well, we lived in Montclair, historic Montclair, a block off of Colfax Avenue, and had a crack house across the street, and but it was a lovely neighborhood. And then that's the starter house we had, and then we moved to Stapleton, which actually made me a believer in planned communities, walkable.
That's the old. So I grew up in Colorado, and I haven't seen it, but I just was there, and somebody was talking to a guy who lived there and really loved it.
I did not.
They took the old airport and made it into a.
It actually has helped, and we have a couple of friends who are urban planners and landscape architects in different groups, and it's actually used in pretty well respected programs as a model of
Yeah, I want to go tour it. I need to get over there.
We had a fabulous house that was, I could run everywhere and walk to the store and walk to the Max, or it's like the
Is it
Max.
like a Renco station out in Hillsboro, but bigger and?
Yeah, much more. They had neighborhood parks, neighborhood pools, neighborhood recreation centers, shopping. Like you could walk everywhere. Wide sidewalks.
Does the train from the airport go through there?
It goes right by there.
Could you? Yeah, you could take. Because I took the train into town last time, and I always wanted to do it because that airport is such a pain in the ass. It's like. You're not even in Denver. You're in Kansas, and then you have to go to the rental car place, and then you have to drive to Denver. Right, and I just hate it. It's like carbon. But you just go and you just jump on that train. It's beautiful.
Yeah, it was really wild. We were there one day for a flight and could see a tornado coming up.
Seriously?
Yeah, the whole Kansas thing's real.
I hate flying to the airport in the summer.
Yeah.
It's like this. It's like.
I came from SeaTac, so it seemed like a really great airport to me.
Do you ski?
I do. Yeah,
Nice.
but we mostly cross-country ski now.
Yeah. Safer.
I have a problem with I'm a pretty diehard climate person, so I actually have a problem with the energy that we expend.
It dawned on me, like, I'm kind of, and I was like, geez, I spent my whole childhood and life skiing, and it might be the worst thing you could possibly do.
Lots of people driving up to a mountain to enjoy the snow that's disappearing because we're all driving up to it.
And what do you think those lifts run on?
Yeah, no, exactly. Yeah, and those snowmaking machines that
No, it starts
blowing
to
water, like the whole thing.
Yeah,
So cross-country skiing. Love
I'm
it.
kind of there. Or AT skiing where you know. But and Steamboat Springs has one of the biggest underground mines in the country that you can see from the top of the mountain, and that's what runs those lifts. And I'm like, you guys have to choose.
Yeah, no, it's
one or the other.
I love it. I know that many of my friends and supporters would be very angry at me saying that, but I think that our ski slopes need to die slow or quick death.
or we need a ski train up 26, and Renewable energy.
How
you could do
yeah,
it.
You could do it.
I mean, they should have a ski train up
Colorado has
I-70.
proven that even when there's a will, there's sometimes not a way. That was one of the reasons we left, was the traffic and whatnot.
No, it's crazy.
Which you didn't ask me about, which I
No, I-70.